Hello friends, welcome to Brain Scoop channel. This is my new video and our today's topic is Barium Swallow. So what is Barium Swallow? It is a medical imaging procedure used to examine upper gastrointestinal tract, which includes the esophagus and to a lesser extent the stomach. The contrast uses barium sulfate. So there are basically three constrictions in the esophagus. First is superiorly at the level of cricoid cartilage, juncture with pharynx. Then the middle crossed by aorta and left main bronchi, and inferiorly by the diaphragmatic sphincter. So what are sphincters? There are two high pressure zones prevent the backflow of food. The upper esophageal sphincter and the lower esophageal sphincter. It is located at upper and lower end of esophagus. Contrast. There are two types of contrast studies. The first one is the single contrast study and the second one is the double contrast study. Then contrast uses 100% barium sulfate paste, 80% barium sulfate suspension and 30% barium sulfate suspension for high kV techniques. 200 to 250% high density low viscosity for double contrast study. Indications of the barium swallow are dysphagia, heartburn, retrosternal pain, then hiatus hernia, reflux esophagitis, then stricture formation, esophageal carcinoma, motility disorder like ascalgia, diffuse esophageal spasms, pressure or invasion from extrinsic lesions, assessment of abnormality of pharynx esophageal junction including Jenker's diverticulum, second is the cricoid webs, then cricopharyngeal ascalgia. Then the contraindications are suspected leakage from esophagus into the mediastinum or pleura and peritoneal cavities. Second is the tracheoesophageal fistula. Views taken in the barium swallow are: the first one is the soft tissue neck, that is AP and lateral, which are the scout films without contrast. Then neck AP and lateral with contrast, and the thorax, that is RAO, right anterior oblique view. So this is the normal AP and lateral view of the scout film. This is the normal view and this is the lateral view. Then right anterior oblique view. Next is the patient preparation. None in particular, but advisable to be in NPO prior to the procedure. Ensure that no contradiction to the pharmacological agent used. Check pregnancy state as radiation is used. Next is the procedure should be explained to patient before undergoing the procedure. Technique. The first one is the pharynx. One mouthful contrast, bolus with high density, that is 250% weight by volume. Patient is asked to swallow once and stop swallowing thereafter. This is to get optimal mucosal coating. Frontal and lateral views X-ray taken. Then for the esophagus, the single contrast, multiple mouthful 80% weight by volume barium suspension given. Prone swallow to assess esophageal contraction. Useful in esophageal compression, displacement or disordered motility. Next is the double contrast, contrast high density and low viscosity. 15 to 20 ml given and asked to swallow. Then effervescent powder given with another mouthful of barium. In erect posture, guests tend to stay up, so adequate distension stays longer time. Injection Buscopan IV given before the procedure to keep esophagus decentered for longer time. Now there are some specific conditions in the barium swallow, which are as follows. The first one is the esophageal web. May be demonstrated with high volume barium esophagograms and esophagus is fully decentered. A jet effect of contrast passing distal to the web may be seen. Next is more about the esophageal web. More commonly occur in cervical esophagus near cricophageus muscle than in thoracic esophagus. They typically arise from the anterior wall and never from the posterior wall. They can also be circumferential. Next is the foreign body impactation. To detect the level of obstruction in case of radiolucent foreign body in esophagus, marshmallow coated with barium is swallowed. Passage of marshmallow will be hindered at the level of the obstruction. Barium swallow shows irregular areas of narrowing and dilatation. This is diffuse esophageal spasm. Next is the CA esophagus. That is calcification of esophagus. Preferably high viscosity with normal density barium is used. Classical findings in carcinoma, rat tail appearance. This is the CA esophagus. Next is the Astalgia cardia. Barium swallow showing dilatation of the esophageal body with short segment stricture. A bird peak-like trapping of the esophagus at the GE junction. This can be seen. Next is the hiatus hernia. High abdominal pressure is required to demonstrate. Patient has to stand, lie down, straighten legs and then raise them up. Manual compression of abdomen. Patient stand upright. Ask him to bend downwards with legs straight. Stomach should be distended to demonstrate hiatus hernia. Barium meal in tender leg position. Displacement of cardioesophageal junction above the esophageal hiatus. Part of the stomach is present in the chest. Reflux of barium into the esophagus. Next is the gastroesophageal reflux. This is known as SIPHON test. That is siphon test. Fill the stomach with 50% barium, 150 to 200 ml. Follow this 1-2 mouthful of water to remove traces of barium in esophagus. Patient in supine with left side raised 15% up. Keep 1 mouthful of water in patient's mouth. Ask patient to swallow water. A jet of barium will shoot into water column as it enter in the GO junction. Alternatively, with full stomach, ask patient to roll side to side. Reflux can be seen. This is the esophageal reflux. Reflux esophagelitis with deep ulcer. Straight arrow, as this can be seen with deep ulcer. There is also asymmetric narrowing of the distal esophagus with a relatively abrupt cutoff at the proximal border of the narrowed segment. Next is the Barrett's esophagus. The reticular mucosa is the characteristic of the Barrett's columnar metaphyseal, especially with associated web-like structure. So this is Barrett's esophagus. Now there are some complications related to the barium swallow. They are aspiration, then leakage of barium from suspected perforation. This is all for today. If you like this video, please like, comment and share. And do subscribe my YouTube channel for further updates. Thank you.